In Blackburn with Darwen, we know that there is a strong link between childhood health and experience and adult health and well-being. Adverse childhood events, such as being exposed to violence or abuse of all kinds, or lacking stability in care at home, can lead to poor physical and mental health in the future, and can also involve a child in a cycle of poor behaviour which they risk passing on to their own children. In Blackburn with Darwen, we're taking an innovative approach to the national programme of intervention with troubled families.
Every local authority has been given funding to address, to identify first of all those families which cost the public purse the most money and meet certain criteria, which includes high levels of antisocial behaviour, youth crime, high levels of truancy, poor attendance at school, and an adult in the household who's not in work or who's not employed or is on out of work benefits.
Adverse childhood events, such as being exposed to violence or abuse of all kinds, or lacking stability in care at home, can lead to poor physical and mental health in the future.
The more different kinds of adversity you experience, and the more frequently you experience those things, and the more severe, the more the risk of you developing a mental health problem or a physical health problem or a poor social outcome later on.
Adversity is often the root cause of problems in families, so the Troubled Family Programme uses a single point of contact to coordinate services and support for families. Having a single point of contact means that a close relationship builds, leading to better results.
So the young person in the family that I'm supporting, she had very low school attendance, getting in trouble with the police quite often, missing from home, and basically wasn't engaging with anybody. When I started working in the family, built a relationship up with the young person, supported her in attending school, found out what the issues were of why she wasn't attending school. Before, the young person was quite withdrawn, didn't really have any ambitions for the future, but now she's thinking about what she wants to do when she leaves school. She's thinking about what she enjoys to do and more active and wanting to get involved in things instead of just messing on the streets or staying at home.
The programme also puts value on the family's willingness to help themselves, another factor which underpins success.
What we're finding is that the families who are involved with the programme are as much a part of providing the solutions as anyone else, and we're encouraging those families to come up with the solutions themselves, as well as bringing in and coordinating those professionals to support those families to make those changes that they want to make. Because fundamentally, if you've decided that you want change, then change can happen. So we want to support that process.
I think there is probably a shift in thinking in our health and social care system. And I think there's just so much more research now that tells us that a lot of the problems we see in our society are actually the result of adversity, trauma, abuse, difficult things happening to people that really set them off on the wrong pathway. And unless we intervene, the outcomes are going to be pretty negative.